Dear colleague, welcome. It's Dr. Jack, and today I'm going to talk about sustainable empathy and compassion. I've written and spoken before about compassion fatigue and clinician burnout. So if there's such a thing as compassion fatigue, I think it's important then to talk about how, as clinicians, we can continue to be compassionate and to avoid burnout in a sustainable way. And this came to my mind when, just a few days ago, I learned that my friend died. It was unexpected, for me at least. The members of the family knew that he had not been doing well, but the rest of us were quite surprised at the suddenness of his death. And my thoughts quickly turned to my two other friends, both of whom are living with pancreatic cancer. Both were diagnosed around 3 years ago, within a few months of each other, have undergone extensive surgery, the Whipple procedure and chemotherapy, and are continued to be monitored, having every 6 months to go in for a whole battery of tests. And it really made me think much more deeply than I had before about what it's like to live the life that they're living now. What is it like when you wake up every morning and you think, like, what's this day going to bring? Will there be something that I feel, like a twinge in my abdomen, a moment of double vision, maybe a feeling of lightheadedness, something that will make me think, oh my gosh, is that the cancer coming back? And of course, it may be nothing, but it may be the start of something. And it's really living life in a state of continual uncertainty, what I like to think of as a radical contingency. And then that got me thinking about, as clinicians, how do we sustain our compassion and our empathy towards our patients? And I realized that part of it is through asking such questions of ourselves as I was asking myself when I was thinking about my two friends who have to live with a diagnosis of pancreatic cancer. So let me talk about empathy. There are three types of empathy. There's intellectual empathy, emotional empathy, and compassionate empathy. So intellectual empathy is really the ability to take that other person's point of view. It's perspective taking. So it's asking oneself, what is on this person's mind? What are the challenges they're going to be facing? What are the implications of what has happened to them or what might happen to them? So it's really on the intellectual or cognitive level. Emotional empathy is, of course, having to do with emotions, imagining and experiencing more directly the emotional distress that someone else is experiencing. And the way that this is done is through really imagining oneself facing those same type of scenarios, or remembering back in one's own life when one faced some crisis situation. And then the third type of empathy, compassionate empathy. This is really focused on action, so that one feels compassionate enough to take action to help relieve the other person of their distress, some way reach out to help them. So my method of being able to sustain empathy and compassion is really to primarily focus on intellectual and compassionate empathy. Now, I have to say something important about emotional empathy, because emotional empathy is really the basis of the other types of empathy. So it really takes experiencing directly, feeling the emotions of what that other person is feeling. However, and this is where the crux of my method, I do not feel that I have to feel pain, that same sense of pain and distress and uncertainty, the fear, the anger, the sadness, the anxiety, as the patient feels every time I work with a patient. But at some point in my life, I did. I would put myself in those situations, or I would think back to my own times where I've been hurt or betrayed or whatever it was. So I feel like I do have that sense of understanding that is derived from the emotional empathy. But having kind of gone through that before, I don't feel like I have to put myself in a situation of emotional pain now each time I work with a patient. So the emotional empathy works as a foundation because it helps you, the clinician, really understand the intellectual part of it. It helps you, really directs you towards understanding what that person may be facing, the challenges they're facing, the kind of reactions that they may have through it. So yes, it's occurring on an intellectual level, but it derives from that emotional empathy. And then the same thing with the compassionate empathy, which is really about taking action. But you know, as a psychiatrist, I don't feel like I need to feel someone's pain in order to be motivated to do my very best to help them, to help alleviate their hurt, their suffering, to do whatever I can to help them. So again, the way that I protect myself and stay strong is that I do not, in a way, allow myself to experience that level of emotional pain when I work with patients. I only do it to the degree that I feel I do not understand intellectually what they might be going through and what I need to, recognize within them in order to direct me to be the most effective clinician that I can be. So it's not that I never feel emotional empathy, but I modulate it. And I think this is very important, not only for me to protect myself, because, as a clinician, we all tend or want to have careers that can stretch into decades. And so we have to do things in a way that are sustainable to us. Now, there's another part to this, and maybe an even more important part. The patient, when they come to a clinician of whatever type, whether it's me, a psychiatrist, or maybe an oncologist, like a person with cancer, they do not need a clinician to be experiencing that same level of distress or pain that they are. That is not what they're looking for. They're looking for understanding, for someone who cares enough and is motivated enough to act competently on their behalf. And so my role as a clinician is to stay strong, to be decisive, and to maintain my ability to act competently. And again, I only allow myself to feel enough of their pain or the nature of their pain or distress enough to allow me to understand and to act in the correct ways. So what are the actual steps that I take in terms of the sustainable empathy? Well, for me, the first step is really to maintain a sense of curiosity, to start asking myself, well, what would it be like? Just as I did when I started thinking about my two friends living with pancreatic cancer. And I've known them for many, many years, and I've known that they've had cancer for close to 3 years. And it wasn't that I was unempathic or unsupportive. I was supportive and empathic, but I never really stopped to think deeply, what is it like to live with that sense of uncertainty, that sense that any day can bring bad news that can really then be the start of the coming end of my life. I never asked myself that. I don't know why. I wasn't curious enough. I don't know. Maybe there's something that made me stand back and not consider those type of questions. But the death of my friend certainly triggered that in me. So in order to have that sense of empathy, I need to have that level of curiosity, deep curiosity, and to start asking questions. What is it like for you to face this uncertainty of your future, knowing that, you know, you could hear bad news. What is that like for you? And that it's not only asking questions, but it's also asking the difficult questions that no one else is probably asking that person in their lives. Family members don't like to bring up the fact that someone with cancer can die. Friends don't want to do it. Sometimes even the oncologists working with patients don't really talk about those kind of things. They want to focus on the upbeat and all the things that could be done and all the other protocols that could be tried. They're they're maintaining their role as really competent actors, but not wanting to explore those emotions of fear, of uncertainty, of anger, of sadness, of grief, right? So it's my job, and I may be the only person in my patient's life who's willing to ask questions, including those hard questions. And then after that, it takes a lot of listening and trying to understand, again, on an intellectual level, understand what are the implications of what the patient is feeling and experiencing. What do they think is going to happen? What can I do to help? Where are they in their process of grief, of planning for the future? I can be a support for them while maintaining my emotional equilibrium to, again, be that steadfast source of strength for them in those times of great need. Now, as I mentioned, getting too much into feeling the pain, being too emotionally empathic with a patient can actually be counterproductive if it makes you, the clinician, kind of weakens your resolve and makes you less active and less able to take those actions that the patient needs you to take. If it decreases your ability to ask the hard questions because they may be too emotionally difficult for you to do. So again, I'm not saying not to experience emotional empathy. At some point in your life, I think you have to. I've worked with many, many patients with post-traumatic stress disorder, and I've thought a lot about it, about all of the various consequences and psychiatric symptoms that people can experience. So I've already gone through that. I already know, potentially what to anticipate. I know what questions to ask and what answers, what nuances to listen for so that I can pick up on them. Now, there's another topic I want to raise to you. It's now different than what I've been saying, but related to sustainable empathy. So especially among people who are by nature compassionate, right? And I know a lot of people in mental health who are quite by nature compassionate people. And the danger is it's easy to get overwhelmed by all of the, all the needs of the world, all the suffering of the creature that the creatures of the world experience, our fellow human beings. And it's easy to get overwhelmed because you realize that you can never resolve all of these problems. They're just so much bigger than you. There's no end to the pain that occurs in the world. But you only have two options. You could choose to do nothing, or you could choose to do what you can do. So you have to find that boundary where your compassion, your empathy is sustainable. Only you can say no. The world will continue to either demand from you or, provide you opportunities to continue to give more of yourself without end. So it's up to you to find where the boundary is and to say no. to place limits on yourself. And you need to have the strength to continue to act as a clinician, being as most helpful to your patients and acting with as much compassion as you're able to, with the full realization that whatever you do will never be enough. So signing off, this is Dr. Jack. Thank you for listening.